Top of the morning to you once again. Welcome back to the Afia Morning Show. Happy new month. It is the first day of September 2025. Now August meeting is over. Christmas is just around the corner. So every reason to smile and start saving up so that you don't get totally overhauled and stretched this season. Now away from there are people who also deserve our love and support every season, regardless of what it is. And those include indigent patients at various hospitals across the states, across the region, and across Nigeria. We're joined now in the studio to tell us more about why these patients deserve our support by Professor Theresa Nwagha, who is a consultant hematologist, UNTH, and the CEO, UNTH Foundation, Ituku-Ozalla, Enugu, alongside Dr. Florence Onuoha, Indigent Patients Welfare Officer, UNTH Foundation, Ituku-Ozalla, Enugu as well. Thank you both for joining us.
Thank you, Natalie, for having us. Thank you.
Yes, and we have to start by giving you all your flowers for the cause you are involving yourselves in. You are not just doing what everybody's doing. You're saying indigent patients deserve our support. Now, the word indigent, they'll say they've come again with their English this morning. Could you please break down, Professor Theresa, what it means to be an indigent patient?
Thank you, Natalie, for that very important question. Indigent patient simply means someone that cannot afford to pay their medical bills. Not only that, they don't even have the support system. You know, the way our community is structured, if you can't afford it, at least you have an extended family member that can help you, or an extended cousin that can step in and pick up your bills. But these individuals do not even have that social support system. They are poor, they don't have any source of livelihood, and sickness does not look at faces, whether you have the livelihood or not. So once you're ill, you come to the hospital. And as you're well aware, most patients still pay out of pocket. If you don't have a source of livelihood, if you don't have a support system, you find out that you can't afford to be sick, all right? But most times they are sick. They are in the hospitals, they take up hospital beds, they can't pay their bills, they can't even pay for food in the hospital. They can't pay for procedures, and at a point in time, they get stuck. They can't leave and go home. They can't access care. And that is where we come in.
Paint a picture of what is on ground at the various hospitals, maybe specifically UNTH.
Okay, thank you for that question. UNTH is a tertiary hospital. It's a premier tertiary hospital in Enugu. It's located at the outskirts. It used to be at the center of town, but about 20 years ago, it was located at the outskirts. It became like what I tell myself, out of sight, all right? So in hospitals, you have a myriad of people that come to access care, all right? It's a government teaching hospital. Whether you have the funds to access the care or not, you're brought to the hospital. At a point in time, because of the paucity of funding, it's not like what we used to have it 30, 50 years ago, where you will come and the hospital can give everything you need and then they bill you later. Right now, it's based on what you can afford. That is how you assess care. So these patients come in and the hospitals try, at least within the first 24, 48 hours at UNTH, to ensure that the person doesn't die. But after that, you need to be able to pay something for you to continue to assess care. And that's where they get stuck. At a point in time, they can't pay for even paracetamol. They can't pay for their bed space, they can't pay for investigations, and they are stuck in the hospital. They can't go home because their illness is still there. They can't stay in the hospital to access care because they can't afford to access care.
I mean, it's a horrible picture.
Yes,
and just imagine not being able to afford PCM, and then let alone food to even take the PCM in question.
So I'll ask this question. What are mostly the kind of emergencies, the conditions that these patients encounter that gets to the point that they can't even, carry on to access medical care?
Well, it's such a horrible one. Take, for instance, an accident victim who will be brought in unconscious. This patient doesn't even know where exactly he is, at least for the first 24 or 48 hours. It's been others taking care of him. He can't even take decisions on himself. These patients will stay there even after resuscitation, trying to find their bearing. Some will even go as far as losing their memories. They can't even recall the environment where they are. And at that point, they are stopped. So it is done on this patient that without the help of people like UNTH Foundation or other good-spirited individuals around the patient, you can imagine how this patient will go through this condition for as long as he comes again to his consciousness. It's as bad as that.
NHIA, formerly
Yes.
NHIS.
Yes.
That's the probable, topic on everybody's mind now to
Yes.
discuss it. I mean, that's supposed to provide for such situations. I mean,
Yes.
it works in foreign climes.
Yes.
How does it work down here?
Okay. What I will start by saying is that a lot of Nigerians are still uninsured. All right. And the majority of those that are insured are either in government parastatals or they are in private parastatals. All right. A lot of other that are not captured in these two are so uninsured. And because that happens, that's why I started by saying that majority of people still pay out of pocket. Imagine somebody that is indigent, no social support, has hypertension, needs to be seen regularly at the clinic to be able to assess care and have his medication. At a point in time, he leaves himself or herself to the will of the Almighty to protect, which is a good one still, or to whatever providence that is there. So we at UNTH Foundation, we are tinkering of the idea of actually providing insurance for the uninsured, for our indigent patient, because we don't want to make it a one-off thing. Yes, somebody is sick, cannot afford care, but you know that sickness is not a one-off thing. At a point in time, the person will still get to be sick again. So if we have support and we're able to purchase, say, health insurance for those that are uninsured, then those people can easily access care whenever they need it, because they have an organization that is paying capitation for them. All right. So, but we can't do this alone. We need the help, and we need collaborations for organizations to please step in and see how we can at least do the needful. Nobody ever gets poor or lack by giving.
Yeah, sure.
All right.
So
Yes.
many people will be watching right now to, and be touched to be part of this and help this indigent patient. What avenues could be made available for them to, come in and help?
Actually, we are here. And that's why we are here. We want to collaborate with a good, spirited individuals, philanthropists. Truth be said, many people are doing something out of their, will to help. But we can say that because UNTH is out of sight, unquote, they understand, it makes it, a little bit challenging. You want to help, you want to assist. You say, oh, we have Parkland here, we have other institutions where we can
go to Ituku.
You don't want to go to Ituku. Do you understand that, it's, a little bit out of town. So it becomes maybe a little bit difficult for people to come in and help. So that's why we are here crying out for collaboration. We want to partner with people. Even if you cannot come, you can get in us. You understand? Yes, you can get in us. Yes. Do you understand? But we will wish that you come because you witness it with your eyes and you see what is happening and you'll be able to do what you can do. Do you understand?
Let's talk about numbers, because some people think in numbers.
Oh, yes.
How would you rate the statistics of the indigent patients through your foundation at UNTH?
All right, that's fine. So if let me simplify it, all right, so we don't get lost in numbers. If 10 persons visit the hospital, all right, at least 3 to 4 out of 10 are indigent, can't really afford their care. And then depending on the type of ailment that they have, all right, even if they come with the meager funds that they start off with at the initial onset, let's say somebody has malignancy, By the time you purchase your first cycle of chemotherapy, find out that it totally dries you out. There is no support, nothing. You're stuck in the hospital, you can't afford the second cycle, you can't even afford radiotherapy, things like that. So it is really a staggering number that needs for people to actually raise an eyebrow and say, we need to step in and do something.
What's your stand on keeping patients in the hospital until they pay their bills? Some patients, of course, have already accessed some level of medical care, great medical care, professional medical care, but they're unable to pay their bills and they can't be let go of until they pay those bills. What's your stand on hospitals that have to enforce the bills?
All right. Personally, all right, I really want to say that the chief medical directors of hospitals are actually pulling rabbits out of hats with the amount of funding that they get and what they're expected to do. All right, we expect them to do magic, but they are, in quotes, running a business, healthcare business. All right. Yes, there were times initially, years back, where a chief medical director would say, okay, this person is indigent, this person has stayed for months, let's write off the bill. They can't afford to do it now. All right? Because everything has to be paid for. My dear, do you know how much it costs utilities, light, keeping light in the hospital, ensuring that light stays 24 hours, or even water, ensuring that there is water for healthcare professionals to wash their hands, or even consumables, all right? So you really can't blame them when they insist you need to pay for us to give you care.
All right, now
Yes.
we're out of time, but we have to ask you this, and I would like you to answer directly if you can. Now, people are watching this, they realize now that there's a hospital somewhere in Ituku that patients are looking for help, okay? It's not Park Lane, it's not, it's in Ituku, and that's quite a drive.
Yes.
How can they reach these patients, access them? How can they provide that support? And for some who are watching this from diaspora, because we have an amazing diaspora community as well, how can they be a part of changing the narratives of these patients?
Okay, our websites are there. If they can't come in person, we are on Instagram, we're on Twitter, we're on Facebook, all social handles. They
Can
are
you
there.
call out the handles?
What?
Can you call out the handles?
Okay.
All right. Yes.
All right, go ahead, Professor
So
Theresa.
you check out our website at unthfoundation.org. All right.
All right.
When you get to the handles, it's easier access.
Navigate.
All our handles, all our social media handles is just a click away. Find our Instagram, click it. It takes you directly to our Instagram. You see everything that we've been doing, all our activities, everybody that we've helped so far are all there. What you can do to collaborate, participate, join us, collaborate with us. It's all there on our website.
So I have two questions.
Yes.
For some of us who are monitoring spirits.
Yes, sir.
How do we track our finances? How do we track? And secondly, how do you select the indigent patients to help?
Beautiful question. Beautiful question. She laughs because that was the first thing I did when I started as the CEO. I said, listen, you are spending people's money. You must ensure that this money gets to the right person. So we have a checklist. We have a checklist that once we get, say, an application that people need help, we apply our checklist. And once the person meets the number, we step in and help. Transparency is the key. We have our quarterly newsletter that we send to all our donors. Everything that we do is on our website. You can call us. You can demand for our records. We are frequently audited internally, all right? And then we also externally audited. So we really have nothing to hide. Our hearts, the heart of UNTH Foundation is in the right place. Adopt us as your favorite foundation and help this indigent patient. They really deserve to be helped.
Your office, is it situated in UNTH?
Yes, it's situated
and
in
you
UNTH.
work with the management of UNTH
Yes.
as well. All right. Thank you so much for bringing this to the fore.
Thank you
and taking
so
us to
much.
Ituku.
Yes,
just
sir.
in 15 minutes. Thank you once again. All right,
Thank
the
you
morning
so
show
much.
has now come to an end. We're out of time. Up next is the Business Morning with Marvelous Apamaga. Until we meet again, same time tomorrow, same channel. I remain your host, Nathalie Uku.
And I remain OG Nwagha. Have a great day. Bye for now.
All right.